What is the full impact of PCOS on queer women's health? Have you ever wondered how polycystic ovary syndrome, commonly known as PCOS, affects queer women's health? This hormonal disorder is more common than many realize and can have a significant impact on sexual and reproductive health. Let's break it down. PCOS is characterized by irregular menstrual cycles, elevated levels of male hormones, and polycystic ovaries that can be seen on ultrasound. Research shows that PCOS is more prevalent among lesbian and bisexual women compared to heterosexual women. In some studies, up to 80% of lesbian women had polycystic ovaries, and around 38% were diagnosed with PCOS. One major concern for queer women with PCOS is reproductive health. PCOS is a leading cause of ovarian dysfunction and infertility. For those who want to become pregnant, this can mean facing more challenges and possibly needing fertility treatments. Awareness and screening for PCOS are essential for timely diagnosis and management, especially for those seeking fertility services. Additionally, PCOS is linked to metabolic and cardiovascular risks. Queer women with this condition may experience insulin resistance, obesity, and a higher risk of type 2 diabetes and heart disease. Addressing these risks through lifestyle changes and medical care is important for overall health. Mental health is another critical area. Queer women often face higher rates of anxiety and depression due to societal pressures and stigma. The physical symptoms of PCOS, such as weight changes and acne, can worsen body image issues and mental health challenges. Therefore, it is vital to include psychological support in their care. Unfortunately, many queer women encounter barriers to health care. This can include a lack of understanding from healthcare providers about LGBTQ+ health needs and assumptions about sexual behavior. Such barriers can lead to underdiagnosis or delays in treatment for PCOS. It is crucial for healthcare providers to offer inclusive care that respects queer identities and addresses specific health concerns. The hormonal effects of PCOS can also influence sexual health. Elevated male hormones may affect libido and sexual function, though experiences vary. Open communication with healthcare providers about these changes is essential for maintaining sexual health. While PCOS is not directly linked to HIV or sexually transmitted infections, it is vital to consider sexual health comprehensively. Healthcare providers should integrate PCOS management with education on HIV and sexually transmitted infection prevention tailored to queer women's needs. For queer women living with PCOS, regular screening for metabolic issues is beneficial. Access to fertility counseling and reproductive options that align with their family-building goals is also important. Mental health support should acknowledge the dual impact of PCOS symptoms and LGBTQ+ stressors. Understanding the full impact of PCOS on queer women's health means recognizing both the biological aspects of the syndrome and the social context of health disparities. Addressing PCOS in queer women involves integrating reproductive, metabolic, mental, and sexual health care within supportive healthcare environments.